All right, so you're still watching Midday Live on TV3. Let's turn our attention to the health sector. And the health sector in Ghana could suffer as Danish International Development Agency, DANIDA, says it would withdraw support to Ghana. The withdrawal of the funding by DANIDA, according to the Danish ambassador to Ghana, Towe Dengbol, follows Ghana's attainment of middle income status. It is expected that by the end of 2020, the Danish support to the Ghanaian health sector dates back to, well, we are told that it dates back to the 90s, the mid-90s, might have a toll or take a toll. The overall aim of the Danish support to the Ghanaian health sector is to contribute to poverty reduction and to achieve to the achievement of Millennium Development Goals. So how will this impact or have an effect on Ghana's healthcare delivery? And we would be speaking to one of the institutions that work directly in the health sector. And one of the executives has joined us in studio to have a discussion with regard to this decision by DANIDA to pull out of Ghana. I've been joined in studio by Dr. Gabriel Biel Banaku. He is the national chairman of the Ghana Coalition of NGOs in Health. Good morning, sir. Yeah. Sorry, I beg your pardon. Good afternoon. Yes, and thank you very much for joining us. Is there a reason for us to be afraid or to worry that DANIDA intends to pull out in terms of services and aid to Ghana?
No, good afternoon, Ghana. We should not be afraid, but we should rather take advantage of the situation to reorganize our health sector very well. DANIDA, over the last 22 years, right from my internship up to date, I have always worked with DANIDA. So I quite understand how much DANIDA have actually pumped in terms of human resource, in terms of infrastructure development, in terms of technical cooperation in the health sector. Nonetheless, they have also supported the private sector. You remember DANIDA have supported over the last 10 years what we call the Busak Fund, which has cut across all sectors of the economy, health, advocacy issues, transforming agriculture and all those things. But if we come to the health sector itself, DANIDA have supported the most poor regions and districts in Ghana, where doctors would not have stayed. Through the work of DANIDA, doctors were motivated to stay there. In fact, those doctors became some of the best doctors who receive award in Ghana. And so you can quite appreciate the work of DANIDA in that regard. I also know how much DANIDA have pumped into the cheap compounds, the deprived community where people will have moved over.
So if they've done all of these, which are quite commendable, why shouldn't we then worry if they decide to leave or they are deciding to leave? And
yeah, we are an independent state. We are a democratic society.
You mentioned that we should take advantage of it.
Exactly.
What kind of advantage?
We are an independent state. We should be looking at some of the transformations that has happened in the health sector and take advantage of it. Let me give you a typical example. The governor of Ghana in 2012 adopted what we call the public-private sector policy. So the PPP arrangement now presents itself for Minister of Health, Ghana Health Service, to begin to see how can we use our private sector to get additional source of funding into the health sector, but in terms of infrastructure development, in terms of human resource, in terms of training, and in terms of even economic cooperation in the health sector, bringing specialists from other countries to support, or using the corporate social economy to diversify into the most deprived areas that we could get funding
But
for.
when DANIDA was doing all of this, it didn't bar or prevent the private sector and all those policies that you're mentioning to work alongside it.
No, we have. What I'm just trying to say is that we have not utilized fully the PPP arrangement we have as a policy that directs us as to how we should really consciously come out with program by the Ministry of Health to say that we are using PPP as one of the drivers to get additional support into the health sector. That has not happened. And we are calling on the minister to open up. The government is by the people and not from somebody. And so we are a democratic state. we want to see the civil society involvement into the current issue. We will begin to have the impact in a year's time. For now, everything is normal. DANIDA is still supporting the 2016 budget and other health interventions. But in 2017, that's where we will really feel the shock. And the best way is that, even though I always argue that we could have started the transitional arrangement earlier than just 3 days ago to wait for DANIDA to announce officially. We could have started the arrangement. We didn't see that. And what we now need to do is let's begin to get everybody involved. Think through within Ghana, where can we get additional support? Who are the players who can come and pump in either technical support or exactly, and come out with a PPP arrangement in the health sector. CHAC is doing well. CHAC is one of the PPP arrangements. You know, this the church. Exactly, the church has contributed a lot into the health sector. In all the region, you can see
but some
CHAC
of
facilities.
Them were getting their assistance, their financial assistance from DANIDA.
Yes, CHAC has
so if
received
DANIDA
support
is
from
pulling
DANIDA.
out, wouldn't that affect them? Because
fortunately for
30 to 40%.
fortunately for CHAC, their institutional arrangement has been strengthened. And so with the support from DANIDA, CHAC leadership has been transformed. CHAC institutional arrangement has been transformed. And so with the withdrawal of DANIDA, CHAC will be able to provide the services to the communities, and community will pay back because they are already connected with the National Health Insurance. But what we need from government end is that because of the larger volume of the responsibility of government in the health sector, government still need grants and other additional support to transform and strengthen our health system so that they can be sustainable. That we have not been able to do it well.
So we shouldn't worry. There is no cause for.
We should not worry, but we should take advantage of the happening to think critically and think out of the box in the health sector. We will find a solution if the minister involve all stakeholders. The solutions will come, and that will be very great for Ghana.
All right. We would want to say a big thank you to you, Dr. Gabriel B.L. Benaku. He is the national chairman of the Ghana Coalition of NGOs in Health. And he's been telling us that DANIDA pulling out shouldn't be cause for worry, but rather we should take advantage of it as a nation. It's still quite a debatable issue, and probably in the next few days we'll see how all the other players in the health sector would react to this or are reacting to